Hello, welcome to Express Denture Care. This is a segment I'd want to go over the removable partial dentures. So understanding what the difference between the partial dentures is rather important. You've got traditional dentures and you've got partial dentures. What's a partial denture? Well, if you'll notice this partial denture here, so it's got a metal frame. It's got these little holes here, they're missing. Now they don't start out this way. This is actually a finished product. It's got the acrylic and the teeth already built into it, but they start out more like this. Now this model has these little holes here, and it's got these little wires and clasps. So this whole piece of material here, if I can show you, comes off. And when it comes off, you'll see that the model here doesn't have any teeth. This little piece here kind of broke off, but you can kind of get an idea how this looks. So let's say, for example, you have a few teeth missing and you need to know your options on how you can replace it. So you can do one of two things on a traditional sense. One, for a more permanent restoration, you'd like to do a cast partial, which is this. It's called a cast partial because the frame is literally cast out of an alloy material. It's very strong, very resilient to bacteria growing on it, so it's a very, very good piece of appliance. Now this material here gets casted onto your mouth, which is why they go in with very, very nice precision. You can see how it snaps in place. Everything goes in where it needs to. Kind of zoom in a little. And you'll notice that these little mesh pieces right here, they're actually in place so that when we put the teeth, the plastic teeth, the material will go underneath. You can kind of see that there's a little gap underneath there. The material flows in between there in that mesh and holds on, so that way they won't just slide right off. And for an example, this is basically what happens when you put the material in place. And if I flip it over, you can kind of see the little gaps underneath it there. That's the exact same frame that's underneath. So that's what makes the pink material, the denture material, hold on and doesn't fall out. Now this is called a RPD, or removable partial denture. It's considered a more of a permanent type of a prosthetic. This is an upper. You can tell by the palate here. This whole base right here goes up to the top of the roof of your mouth where your tongue would be. And this one's a lower because it's got the little horseshoe shape. Yeah, these are used mainly for restoring missing teeth, and you want to have something for a more longer duration. Now for something temporary, say for example you've got an extraction and you had to get a tooth taken out, this would more than likely be what you get. This is called a flipper, or an acrylic partial. Acrylic partial, they're meant to be used temporarily to hold you over. They're not durable, they're very thick. You'll notice that these cast partials over here are a lot thinner, much thinner in fact. You're looking at millimeters in thicknesses, as opposed to, you've got a really thick piece of acrylic here. Pull this off and you can kind of see how thick that is. Now you can make them thinner. The problem is acrylic is acrylic. If you've ever seen nails done or understand how acrylic works in particular, it's very brittle. You could drop this on the floor from a distance and it would break, it would shatter. You'd probably get some nice clean pieces and it could be mended, but it will break. Having a tooth like here in the front is really more for aesthetics. So it gives you a tooth, it gives you something to hold you over while something more permanent like this is being made. But it is less expensive, and it is something that helps give you something in the meantime, which I don't blame anybody for not wanting it, or wanting a tooth in there while there are permanent partials being made. You'll notice also that the clasps are a little different. This is called a clasp. Basically it wraps around the tooth and it connects in the inside of the acrylic. So this material holds it in place, and it has to hold in place on two different sides, or else the back ends would pop out and there would be nowhere for you to actually hold on. So when you bite down on something, it would pop out. Now this is an upper arch, so when you bite down, this tooth is going to start to wiggle. Of course, in this model, we've got some teeth missing here on the side. I believe the patient's going to have some extractions at one point, so we've got those replaced. But the other positive of having an acrylic partial, if you're in between procedures, let's say, for example, this tooth was still present, or this tooth, let's say the doctor wants to extract, all we need to do is pop off the tooth, and you can literally add material to this and throw a tooth in there. Your provider will be able to add that tooth. It connects right to it. It looks beautiful. You would never know the difference, and you've got a lot of flexibility. That's a simple fee as opposed to something like this, cast partial, which is a precision-made piece of appliance because it relies on these teeth. So if these teeth were to fall out, you wouldn't have any clasp to come around it. Trying to mend these and make them work after they've been made is a relatively difficult task, and you won't get a precision fit. That's why it's usually recommended to have these types of prosthetics remade. So providers typically don't say, we're going to do a cast partial at this point if you have decay or if you have current existing conditions that require you to, you're going to lose more teeth. Then we would say, okay, this isn't the best course of action right now. This would be your best course of action. So getting something like this would hold you over and get you through. So that's a little segment from Express Denture Care on removable partial dentures. If you have any questions or concerns, please feel free to message us or call us. Thank you.